All right, welcome back. Today, you and I are going to be medical detectives. We've got a case on our hands, a patient with a set of clues, but there's a key piece of the puzzle that's missing. So let's dive right in and see if we can crack this thing together.
So here's the central mystery: chills, muscle aches, and a headache. It's a classic trio of symptoms, right? But to really nail the diagnosis, we need to figure out what else we should expect to find. Keep that question in the back of your mind as we start digging through the evidence.
Okay, every good investigation starts with the facts. So let's open up this case file and meet our patient.
Here is everything we know so far. Our patient has been dealing with chills, muscle aches, and a headache for a couple of days. Her blood pressure is fine, her breathing is normal, but look at that pulse, 118 beats per minute. That is fast. We call that tachycardia. And two other crucial details: she's completely alert and she has no prior medical issues. These are our starting clues.
Now that we've got the initial evidence on the table, it's time to do what detectives do best: start analyzing. Let's look at the potential culprits for that missing puzzle piece. So we have a lineup of 4 main suspects. Could that missing sign be a fever, or maybe a specific kind of rash called petechia? What about wheezing sounds in the lungs? Or could it be something like hypoglycemia, low blood sugar? One of these is our answer. The others are just red herrings designed to throw us off.
You know, any great detective will tell you that sometimes the fastest way to the right answer is by figuring out which answers are definitely wrong. So let's start a good old-fashioned process of elimination. First up is petechia. This is a very specific, pinpoint-looking rash that's often tied to really serious conditions, like sepsis. And while our patient is obviously sick, she isn't showing any signs of being septic. That means we can confidently rule this suspect out. It just doesn't fit the facts. All right, let's look at suspect number 2, wheezing. Now, wheezing could point to a secondary infection, maybe like pneumonia. And that can happen with the flu, but it's way more common in elderly patients or people with weakened immune systems. Remember our patient? Healthy adult, no prior history. So wheezing is pretty unlikely right now. Let's take that one off the list too. So what about hypoglycemia, low blood sugar? Well, a major sign of that would be an altered mental status, confusion, maybe some grogginess. But what does our case file say? Conscious and alert. That one little clue is a dead end for this theory. Hypoglycemia is a really poor fit. And just like that, we've eliminated our third suspect.
You know what they say: once you eliminate the impossible, whatever remains, no matter how improbable, must be the truth. And that leaves us with just one suspect standing, the true missing piece of our puzzle.
So why is fever the absolute perfect fit here? Well, let's connect the dots. First, those chills she's experiencing? That's a dead giveaway. That's literally her body's mechanism for generating heat to create a fever. Second, that racing pulse, the tachycardia we talked about. That's a totally classic expected bodily response to a rising temperature. You put all these clues together and suddenly you have a textbook picture of influenza. Case closed.
So, we solved the case. Awesome. But what's the big takeaway for you? Let's quickly go over the classic signs of the flu so you can be a diagnostic detective too.
Here it is, what you should be looking for: the classic flu profile. It's that combination of fever, or even just feeling feverish, with chills, those deep achy muscles, a pounding headache, and that overwhelming feeling of fatigue or malaise. These usually hit you like a truck, all at once, and then later you might get the cough and other respiratory stuff. That's the pattern you want to watch for.
We managed to unmask the flu today just by connecting the right clues. But that brings up a much bigger question, doesn't it? So many illnesses start out with these really similar, vague symptoms. So what other conditions might be hiding behind that same mask of fever, aches, and fatigue? Something to think about for our next investigation.